So let's start talking about metabolic syndrome. What exactly is metabolic syndrome? You hear this term thrown around a lot, but it's difficult to sometimes tease apart what are the components of metabolic syndrome and why it's so important. So, we think a lot about weight loss and we think about how we look in the mirror, we think about how our clothes fit, we think about how our joints feel, we think about how we're moving around when we lose the weight. But there's actually a component that can impact your overall health when you lose weight. And so, one of the things we think about is metabolic disorders that can develop from having excess weight. And when I talk about excess weight, I'm usually referring to our body mass index, which is a surrogate we use in the healthcare community. I'm discussing when your BMI is greater than 30. What is this metabolic syndrome? So, I'm talking about the five components that we usually think of, and this is high blood pressure, dyslipidemia or abnormal lipids. So your cholesterol profile looks abnormal. So your triglycerides, your fatty acids are elevated. You may have a low, high density lipoprotein, which is our good cholesterol, maybe low. You could also have abnormal insulin resistance. And so normally our bodies respond to insulin that our pancreas releases, which is one of our organs in our abdomen. And this insulin then goes on to allow us to absorb the glucose in the food that we eat. But when you have insulin resistance, it takes more of this protein or this insulin that comes from the pancreas to absorb the glucose in our bloodstream. And so we may have higher levels of glucose in our blood and can be a risk factor for then going on to develop diabetes. And then you also may see people have increased abdominal girth. So there's more fat, central obesity. And so that could mean that you have more visceral fat or fat around your organs in your abdomen. And then finally, some people may also have kidney problems that develop because of this. So when people have this metabolic syndrome, so they have like this high blood pressure and high cholesterol and increased abdominal girth and insulin resistance or pre-diabetes, and they start to have some kidney problems, then we start wondering or worrying, should we say, about then going on to develop long-term health concerns. And this could be developing a stroke, this could be having a heart attack, this could be getting fatty liver disease, and we don't have a causal relationship. We can't say, okay, if you have metabolic disorder or metabolic syndrome, you'll go on to develop a heart attack or a stroke or have fatty liver. But there is this correlation, this idea that if you have other health problems, you're more likely to then go on to develop these other conditions. And so really trying to focus on how do we lower our risk for developing these metabolic abnormalities is what's so important now. And so yes, I think losing weight and looking in the mirror and feeling great about yourself is really important, but also thinking about what impact will this have on my internal health, my organs, my overall well-being is very important. And I think the GLP-1s have a big place, a big role to play in that because they not only, these glucagon-like peptide receptor agonists, not only help to mimic, but there's some evidence that there could be some anti-inflammatory component to it. So helping with the inflammation that develops from having increased fat storage, that will go down with the GLP-1s. And also just getting that weight off reduces that amount of fat that we see in the abdomen. So I think that yes, we all love that GLP-1s are doing a great job with getting the weight off, but I think we really should be talking about what is it going to do to our healthcare system to just see less and less people developing these conditions later on so that they don't have heart attacks and strokes if they hadn't lost the weight early. And I think GLP-1s we really should be thinking of as more of a preventative, like not waiting till people develop diabetes, not waiting till people develop heart disease, not waiting till people get sleep apnea, but really trying to get ahead of it. Can we do anything to really help before we get to that point of having problems with our cholesterol, our blood pressure, our insulin resistance? Like before we have those things, can we really get ahead of it? And so what I'd like to do is kind of break each one down a little bit more so that we can really start to think about, okay, what exactly are we talking about? So let's talk about blood pressure, for example. So we all probably have heard that there's two numbers with your blood pressure. There's the top number, your systolic, and there's the bottom number, your diastolic. We usually aim for a blood pressure of 120 over 80. That's like great. We think that's a ideal blood pressure, not too high, not too low. We think that it's healthy for your organs. But we start to worry when people's blood pressure becomes higher than this. So usually, at least with people with heart disease, we worry when the top number is above 130 or the bottom number is higher than 90. If you don't have heart disease, we may allow that top number to get a little bit higher, maybe above 140, and start to say, okay, should we start to treat? And again, this is a moving target. Exactly what the ideal blood pressure should be and when we should start treating with medications has always been something we've looked into, because you don't want to let it get too high, but you also don't want it too low. So trying to find that perfect happy medium is something that continues to have a lot of debate. But I would say that 120 over 80 is kind of that ideal number. And then above 130, above 90, that's when we start to say, okay, at least let's start some lifestyle changes. And then maybe over 140, if you don't have any health problems, we start to treat with medication. And if you do have health problems already, like have had heart disease or diabetes, we may treat even earlier than that. And so blood pressure is one of those components of the metabolic syndrome we were talking about, and making sure that we try to treat the blood pressure, and that can be through lifestyle changes. So part of treating metabolic syndrome is not only just the GLP-1s. Obviously, there's more to it than just taking the medication, but also lifestyle changes. So the DASH diet has been known to be very helpful. So lowering your sodium or your salt intake can really help with your blood pressure. Increasing the amount of activity or exercise you do per day really can be beneficial. You want to try to do some moderate or vigorous exercise. You don't want to just be sitting around all day. Even if you're taking a GLP-1, you want to be moving, want to be exercising. And so I would emphasize that lifestyle is a big component still. Okay, then the next thing in the metabolic syndrome, what about your cholesterol, your lipids? So your LDL, or your low density lipoprotein, that's the bad cholesterol. That's the cholesterol you don't want. That's the kind that we think is sticky, that we think is atherogenic, meaning we think that it can contribute to heart disease. So we want to keep that number nice and low. And you probably have seen there's recent update in the guidelines about checking your cholesterol at a younger age, being more aggressive about treatment if you have health problems. Those are things that we have been seeing that might be beneficial to prevent, again, long-term consequences. And cholesterol can be managed with medication, so probably you've heard of statins, but also diet and exercise. And again, exercise, exercise, exercise. Use that body. If you don't use it, you lose it. So making sure you're getting up and moving. Then what about insulin resistance? So let's say we eat a meal, the glucose levels go up, the amount of sugar in our bloodstream. We want to be able to utilize that. We want to be able to use that as fuel to be able to continue to move, to do things. And so that needs to be efficiently processed by the body. But if you have insulin resistance, meaning that the insulin, the protein that is used to try to efficiently use the glucose, is not able to get our body tissue to respond and take up the glucose, then you have some resistance. And it takes more insulin to be able to use that fuel. You want your body to be efficient. You want your body to be using that fuel the best it can. And if it can't do that, then you've got glucose roaming around in your body, which is not good. It can cause consequences to your organs by just floating around. So now you've got all this glucose roaming about, and it can affect your vision, your eyes. It can affect your blood vessels. It can affect your kidneys. I mean, think about all the things that people develop as a consequence of not having controlled blood sugars. That's because the glucose is not supposed to be in the bloodstream. And when it is, it starts to impact all those organs. And we start to see the consequences of that. So again, being able to eat whole foods, plant-based foods, not letting things have high glucose spikes. So you want a low glycemic diet, something where your blood glucose doesn't just spike through the roof. And also GLP-1s are really helpful, right? They help to manage how we deal with the glucose. And then also thinking about central obesity, how much weight we carry in our bellies. So again, people think like, oh, well, I want a tiny waist. But it's not just about having a tiny waist just for appearance. Tiny waist also can signify how much fat we have in our internal organs, in our abdomen. So you might think to yourself, okay, well, if I have a small waist, hopefully that means I don't have a lot of body fat around my organs or visceral fat. You really want to think about, where is that fat going? If it's all in my abdomen, it's not just right underneath my skin. It's not just subcutaneous fat, but there's also fat now going internally around my organs, around my liver, around my pancreas, around my kidneys, and that can really impact your overall health. So I just really want us to be thinking about metabolic syndrome as a process, and it's not something that happens overnight. And each step we take, even if they're small ones, can really make a huge difference in your overall risk of developing these serious consequences. And again, this isn't medical advice. This is just my opinion and something that I think is very important to start talking about. I really just don't want it to be that we all get excited about the GLP-1s without thinking about the other aspect of it beyond weight. I think weight is great. People feel better with less weight on them. But I don't want to forget, like, what about this huge impact it can have on our overall well-being, like overall longevity? It's not just what we look like, but what's actually happening internally. And isn't that something important? Ways to improve quality of life is overall taking care of what I consider our temple, our body. And these GLP-1s can help us do that. In addition to the lifestyle changes that we talked about, like what you eat matters extremely, extremely important, not something to be trivialized. And then exercise, moving your body. So I hope this was kind of a good intro to metabolic syndrome, and we can like draw it out or talk about it in more detail. Just leave a comment below if this is something that you want to have a deeper discussion about. And I'd love to really get into the science of it all and talk about it more if there is a lot of interest, because I think this is really an exciting and an interesting time in preventative cardiology or preventative health in general. Now we really can shine a light on metabolic syndromes and shine a light on preventative care and obesity medicine. So let's get the discussion going. Let's get people excited. Hope to hear from you soon. Bye.